Think the CRC exam is just about finding ICD-10-CM codes? Think again. The toughest questions aren't just about the diagnosis. They test if you can spot HCC risk factors, chronic conditions, and coding guidelines all at the same time. In this video, we'll cover the 10 hardest CRC question types and give you strategies to master them. By the end, you'll know how to avoid the most common traps and walk into your exam confident and prepared. Here's the plan. We'll break down each tricky question type, why it's hard, where test takers get stuck, and exactly how to solve it. First, ICD-10-CM specificity for chronic conditions. CRC coding is all about risk adjustment, so missing a detail in conditions like diabetes, CHF, or COPD means you miss the correct HCC category. Trap. Students pick a general code, like diabetes without complication, when the STEM clearly documents retinopathy or neuropathy. That loses you risk adjustment value. Hack. Step 1. Circle complication keywords. With neuropathy, with CKD, with retinopathy. Step 2. Always verify in the tabular list. Don't stop at the index. Step 3. Eliminate any answer that lacks the complication detail the STEM gives you. Second, HCC mapping. The CRC exam tests if you understand how diagnosis codes translate into hierarchical condition categories for risk adjustment. Trap. Students code the diagnosis correctly, but don't realize that one version of the code risk adjusts and another doesn't. Hack. Step 1. Ask yourself, does this diagnosis map to an HCC? Step 2. Eliminate answers that are too generic, like unspecified hypertension, if a more specific code is available. Step 3. Always code to the highest level of specificity. That's what risk adjustment depends on. Third, multiple chronic conditions. Risk adjustment requires you to capture every condition that's documented and meets coding guidelines. Trap. Test takers only code the primary condition and miss comorbidities like obesity, CKD, or long-term insulin use. Hack. Step 1. Read carefully for secondary diagnoses. Step 2. If the condition is monitored, evaluated, assessed, or treated, it should be coded. Step 3. Eliminate answers that only capture part of the patient's health picture. Fourth, combination codes. Many CRC STEMs involve conditions that have one ICD-10 code that captures both the disease and the complication. Trap. Students code them separately instead of using the combination code. Hack. Step 1. Watch for phrases like diabetes with neuropathy or hypertension with CKD. Step 2. Check if ICD-10 provides a combination code. Step 3. Eliminate separate codes if a combination exists. Fifth, documentation. CRC isn't just about the code. It's about what's supported by documentation. Trap. STEMs may include history of a condition, like history of breast cancer, and students mistakenly code it as active disease. Hack. Step 1. Look for documentation status. History of means Z codes, not current diagnosis. Step 2. Eliminate active disease codes if the condition is only in history. Step 3. Circle words like current, history, resolved, or status post. Sixth, neoplasm coding. These questions test if you know whether a cancer is primary, secondary, or history only. Trap. Students code a secondary site as primary, or forget to use history codes once treatment is complete. Hack. Step 1. Identify if cancer is active, metastatic, or history. Step 2. Eliminate any answer that codes secondary as primary. Step 3. Use history Z codes only when treatment is complete. Seventh, status codes. Long-term use of medications or presence of devices are frequently tested. Trap. Test takers miss that on insulin or pacemaker in place requires additional Z codes. Hack. Step 1. Circle clues like long-term use, status post, device present. Step 2. Eliminate answers that only list the disease without the status code. Step 3. Add the correct Z code when long-term use or device status is documented. 8th, RAF score impact. Some questions ask which coding choice results in the correct risk adjustment factor. Trap. Students focus on accuracy of ICD-10 code, but miss that specificity impacts the RAF score. Hack. Step 1. Identify which diagnosis increases risk adjustment, e.g., diabetes with complication. Step 2. Eliminate less specific codes with lower impact. Step 3. Always ask, which option best reflects the patient's full risk profile? 9th, ICD-10 guidelines. CRC questions test if you apply sequencing and guideline notes correctly. Trap. Students ignore coding conventions like code first, use additional code, or excludes one. Hack. Step 1. Always scan the guidelines section of ICD-10 before coding. Step 2. Eliminate answers that break sequencing rules. Step 3. Use guideline notes to quickly cut down options. And finally, number 10. Full case-based CRC scenarios. These combine multiple chronic conditions, long-term use, history, and HCC capture. Trap. Candidates get overwhelmed and miss half the codes. Hack. Step 1. Break the case down line by line. Step 2. Start with active chronic conditions. Step 3. Add complications, status codes, and history codes. Step 4. Eliminate any answer that doesn't reflect the full patient picture. On exam day, strategy is everything. 2-pass method, first pass, easy wins. Second pass, layered case scenarios. Last 15 minutes, grid check, tab your books, ICD-10 guidelines, diabetes table, hypertension table, neoplasm table, manage time. 100 questions in 240 minutes means approximately 2.4 minutes each. Don't let one case drain your clock. Clue words: watch for history of, long-term use, or with complication. They guide you to the right answer. And that's it. The 10 hardest CRC question types and the exact strategies to handle them. If you're ready to take your prep further, check out our CRC study guide at the health exams. It's trusted by thousands of coders every year and gives you structured, step-by-step coverage of the entire exam. And to really sharpen your skills, our 600 CRC practice questions mimic the real exam, so you can train with the same timing, case scenarios, and complexity you'll see on test day. Both are linked below. Thanks for watching. Hit like, subscribe, and the bell for weekly coding exam strategies. And I'll see you in the next video.